So the first thing you want to do after you've done the injection is check for leakage to make sure that none of the medicine has gotten onto your cat's skin. The medicine itself has a low pH, so it's fairly acidic, and so you don't want it sitting on your cat's skin for very long. So you can just use a really damp washcloth. Some people do use soap, but it's not necessary to do that. Just a damp washcloth is fine if you do see leakage. Before you clean up the leakage, though, you want to try to estimate how much leakage there was, whether it was just a drop, whether it might have been half the dose, or even more than that. It's really important that you get the full dose into your cat. It's better to have more than less. So if you got more than just a tiny drop, then you're going to want to use clean needles and syringes and draw what you think you lost and inject that amount into your cat. If you're really not sure, then and it's less than half a dose, then go ahead and inject half a dose. If you lost more, you think you may have lost more than half a dose, go ahead and give another full dose. One of the great things about this medicine is that unless you're really trying to hurt your cat, you really cannot overdose them. So this is safe at higher dosages, and again, it's better to have more than less, because you need to make sure that they've got enough of this antiviral to get rid of the FIP. So one way to kind of maybe help you test how much you may have lost is draw up half a dose of water into a syringe and inject that, or just kind of spray that onto your cat and see what that looks like, and that might help you estimate how much of that dose you may have lost. And again, you want to use clean needles and syringes to redo that. Some of the things that can go a little bit south on you while you're doing this, one is, as I mentioned, is leakage, which you want to clean up right away. One is if you end up maybe getting too deep, so you're not within that space that you created under the skin and above the muscle. If you get into that muscle, your cat is probably going to let you know because it's going to hurt even more than the injection normally would. What happened at least a couple times when that happened to me is my cat licked the area vigorously, and then he limped around for maybe 10-15 minutes after the injection. It does go away. It's not an emergency situation. It just stings for a little while. It's a valid dose, so you don't need to redose that. So the only time you need to add more is if you get leakage. Another thing that can happen, which seems like it would be really hard to do, but you can actually inject in between the layers of skin. When that happens, basically you'll see kind of a bubble that will form on the skin. It's a valid dose as well. That medicine will absorb into the body. You don't have to do anything, but what I always did is I just kind of took the palm of my hand, put it over the bubble, and massaged it in for a few minutes just to help it dissipate and disperse a little bit faster. Another thing that can happen while you're doing the injection is you might, as you're doing your tent, you stick the needle in one side of the tent, and the needle actually comes out the other side of the tent. And you go and push the plunger in of the syringe, and all the medicine ends up on the side of your cat. Again, you don't want the medicine on your cat, so clean that up really quickly. And then, of course, that is not a valid dose, so you need to pull an entire dose out and start over again and re-inject your cat. If you get any of the medicine on yourself, treat it the same way. Just clean it up really quickly. You don't want it sitting on your skin either. On the off chance that you accidentally stick yourself with a needle, which it happened to me actually at least once. You don't need to worry about it. Just treat it like any puncture wound. So just clean it up, put some antiseptic on it, put a Band-Aid on it, and you're good. GS was actually designed for human use, and so it's perfectly safe for us. So then basically what we did with injections is we had a plastic container where we had washcloths and a little thing of water and things to help clean him up if we did have leakage. We also would always prepare food for him if he wanted to eat right afterwards, and we had his toys. And so right afterwards, usually my cat did not want to eat, but he really wanted to play. And so right after the injection, I would play with him, and just basically positive reinforcement. That worked actually so well that for probably about 9 months after we cured him, he would approach me at 8 o'clock for play, which was the shot time. So that really stuck with him, and so it's something I always like to recommend to folks to do. For every cat, this is trial and error to a certain extent. So some cats are going to react to the medicine more strongly than others. Some are more food motivated than others. Some require a different amount of restraint than others. I always recommend starting with the least amount of restraint and ratcheting up restraint as you find that you need to. Some cats, if your cat is really food motivated, some people can just put food in front of them, or maybe a churu, that lickable treat. Apparently it's like kitty crack. They can put that in front of them, and they can just set their cat on the counter, put food in front of them or a treat in front of them, and they can do the injection in and out, and the cat doesn't even react, or maybe growls a little bit, but doesn't actually try to move away or anything. Other cats, like mine, unfortunately, mine was a pain. So he was a real struggle, and so we needed to restrain him pretty significantly. What we ended up, so there's different ways to restrain your cat. There's cat bags that groomers sometimes use. There you can wrap your cat in a towel, make a little burrito out of him. What worked the best for us the longest is we took a pair of stretch leggings and then cut the leg off, and then cut a little hole, or a kind of rectangular hole in the ankle end of the leggings, and I basically made a little kitty sausage out of them. I just shoved them from the thigh down to the ankle, and lined the hole, and then that gave me a spot to do my tent and do the injection. One thing that is important as far as where to do that injection, you want to do the injection basically on either side of the spine, so not directly over the spine, basically from the shoulder blades down to about halfway down the back. As you get further down the back, the cat has more nerve endings, they're going to be more sensitive back there, it's going to hurt more. So you want to be kind of in that upper part of the back. I recommend shaving those areas on either side of the spine. There's a few reasons why I do recommend that. One is it just helps you see your tent better, so you can see where you're going in. Sometimes there were times where I could actually see the needle sticking out the other side, so I knew I needed to back off. The other thing it does is it kind of gives you a target, so it kind of makes sure that you're staying within that sweet spot for the injection. And then the third thing it does is pretty much the only real common side effect of this drug, or kind of the only one that I'm really aware of, is that it can cause lesions, it can cause sores on your cat. And typically, not always, but typically they're going to happen near your injection sites. And so having that area shaved will help you identify and see sores earlier on, and you'll be able to get on top of them a little bit more quickly. If you do start to see sores, there's a couple things that you can do to assist with that. One of them is a product called Vetericin, and that's something you can just get over the counter at Petco or PetSmart or any pet store. It's just a spray bottle, and you just spray it liberally on the wound, on the sore. and it will help heal it. Another thing that people use is a UV light therapy, like a LumiSoothe. You can get on, I think I can get them on Amazon. So people report that that works as well. Another thing that can sometimes help with the injections is some people report that their cat tolerates the injection better if the medicine is cold. Some prefer it warm, some prefer it cold. Again, that trial and error thing. And then some people also report that if they freeze the needle before the injection, that their cat does better with the injection. So there's a couple tricks you can try. The medicine itself does not need to be refrigerated unless you're going to be storing it for a long time. But it should be in a cool, dark place. So I always kept mine just in a little box in the cabinet, and that's fine as long as it's part of what you're going to be using fairly soon.